Okay, my name is David Bales. I'm chairman of Texans for Stem Cell Research. I would like to thank everyone here today for coming to see what we're doing. We're participating in World Stem Cell Awareness Day, which was originated 5 years ago with the California Institute of Regenerative Medicine. We're here at Austin Heart in Austin, Texas. We really want to thank Austin Heart for having us and Dr. Roger Gammon, who's going to say a few words in a minute. Also, juvenile diabetes is represented by Laura Templeton, and we also have a PhD student in adult stem cell biology at the University of Texas, Daria Nidre. So I want to say thanks to them. I'm going to say a couple of brief words and then let them talk. Right now, there's over 1.2 million Texans living with a chronic disease or illness. There's 517 clinical trials for these various illnesses: diabetes, heart disease, stroke, MS. We believe that number is entirely too low. We think there ought to be over 5,000 of them. Dr. Gammon is currently doing one here at Austin Heart for heart attack patients. He has 19 patients in his trial. We think there ought to be 1,900. Right now, the city of Austin is uniquely positioned to be a leader in stem cell research. We have incredible universities, we've got incredible medical facilities, and we think we are natural to build a stem cell institute here in Austin. And with the help of private, public, citizens, universities, the city, the county, the state, we think that can be done. Biomedical companies will bring a huge economic impact to the city of Austin, and that's important as well as taking care of our citizens. So I just want to tell everybody here, thank you for coming. I'm going to introduce Dr. Gammon. He's going to tell us a little bit about what he's doing, and we sure appreciate you coming. We also have a symposium October the 27th at the University of Texas, where 6 of the top doctors in the country will talk about what they're doing in their stem cell clinical trials. So I want to thank Dr. Gammon and his staff and all of you for coming today. Thank you very much.
Well, thank you, David. We're happy to have the opportunity to talk about some of the things that are going on here at the Heart Hospital and with our group Austin Heart. As David mentioned, we've been involved in stem cell research for cardiovascular applications for about 4 years now. We're fortunate to be involved in the first major trial in the United States using stem cells to treat heart attack victims. It was a phase 1 study, and it was really intended to look at the safety of the application. There were only 6 sites initially chosen to be a part of that trial, and we were fortunate to be one of those, and ended up being one of the leading enrollers. And the trial certainly did show that it was safe to use this, and even showed that indications that it could be beneficial to patients. And so they've rolled into the second phase of the study, which we're also involved in, and in fact the leading enroller in the country. We enrolled the first patient in the trial and now have enrolled many more patients than any other site, and that is an amazing technology of using adult stem cells given intravenously about 7 days after a heart attack, and they travel through the body into the part where the actual damage is and where the inflammation occurs. It draws the stem cells to there, and then they seem to set up shop there and do some very helpful things to reduce the inflammation and scarring that occurs, maybe even regenerate some of the heart muscle, recover some of the heart strength. That's a blinded study. It's an FDA approved study. There's a placebo control, so it's all done the right way so that we really understand the science of whether this is working or not. But we fully support this type of research. It's done in the correct way with FDA supervision and monitoring, and we're very fortunate to be involved in that type of research. We've gone on now to some other studies of another application looking at patients who have critical limb ischemia, which is due to blockages in the leg that are so severe that they're facing amputation, and they don't have any alternative left of angioplasty or surgery. And so those patients may be candidates for another trial that we're doing, again with adult stem cells. This time it's the patient's own stem cells. All of us have stem cells in our body in a number of locations, particularly in the bone marrow. And in this study, we harvest the patient's bone marrow during a simple minor surgical procedure. They're spun down and given directly back to the patient in the same procedure. So it's your own cells And those stem cells know how to do the machinery of growing new blood vessels in the leg. We re-inject them in the areas that's deficient, and it looks like they're capable of regrowing blood vessels and repairing some of the tissue damage there. So that study is underway as well. Again, one of the few sites in the country kind of handpicked to do that work. And then a similar study later this year, probably early next year, again for patients with critical limb ischemia. So important clinical work, and from what we've seen early on with stem cell work, this research has been going on for many years, and it's such a complicated area that it's met a lot of roadblocks, a lot of detours around those roadblocks, and now we really are starting to understand the process of which cells do what, when you have to give them, what are the limitations where they won't work, and what are the possibilities where they were. And there's been a number of trials in the last couple of years with very positive results, certainly in the cardiovascular field, but other fields too, like neurologic diseases, diabetes. And so we really look forward to being involved in the symposium here on the 27th, an opportunity to meet some of our colleagues that are doing similar research and discuss really what the opportunities might be to take this to the next level and have a stem cell institute here in Austin where we can really collaborate and cross-pollinate some of these ideas. So again, we're thankful for your support and happy to be involved.
Thank you. Appreciate that.
Thank you, Dr. Gavin. Thank you, David, and Texans for Stem Cell Research for observing and bringing World Stem Cell Awareness Day to Austin. I speak today on behalf of the Juvenile Diabetes Research Foundation, an organization dedicated to finding a cure for type 1 diabetes and its complications through research. As the leader in type 1 research, JDRF strongly supports ethical stem cell research and the role it plays in understanding and developing treatments for diseases that afflict more than 100 million Americans, including diabetes, cancer, heart disease, spinal cord injuries, Alzheimer's, Parkinson's disease, and other debilitating conditions. Today, we'd like to acknowledge the tremendous efforts of extraordinary scientists and researchers around the world who are using this research to find cures for these diseases. Thanks to this research and those supporting it, we remain hopeful that the suffering of millions will one day be alleviated. Thank you.
Hi, my name is Daria Nidri, and I am a doctoral candidate at the University of Texas at Austin. I'm in the interdisciplinary study between biomechanical engineering, pharmacology, and kinesiology. And my focus is towards the use of adult stem cells harvested from bone marrow, that Dr. Cannon mentioned, as well as from fat tissue for use in orthopedic procedures. David had asked me to talk about how I came into stem cells, and I told him it was kind of by accident. The original professors that I was working with had ended up leaving the university and moving to Vanderbilt, so I was stuck at the university with no program. And then I met Carrie Kindler, who was part of the Texans for Stem Cell Research, and she got me involved with a study and with physicians that were really wanting to look at how stem cells could be used for orthopedic therapies. So after that, she got me involved with this about 2 months ago, and I am so excited to see that the Texans for Stem Cell Research has the passion